Hey everybody, it's Dr. Cole here in our Functional Medicine Center here in Pittsburgh, where we see patients here locally in Pittsburgh, and we have a virtual functional medicine practice where we do webcam and phone consultations for people around the world via our website at drwillcole.com. So today I'm going to, this is live on Periscope, and on demand I'll repurpose it for Facebook page. So today I want to talk about anxiety and depression, brain fog, and the autoimmune connection. Millions of people are going through these problems. Depression, anxiety are probably the top debilitating problem for people dealing with it on a daily basis. And so many millions more have this low-grade background anxiety or low-grade mild moderate depression that go undiagnosed. And then we know obviously that the millions that are diagnosed with anxiety disorders and depression disorders as well. And then brain fog is something that people just take. They just don't even realize they have it. They are just going through their life with this muddled, foggy thinking and think it's just normal because they've had it for so long and everybody else has brain fog, so they just think it's normal. Just because something's common doesn't mean it's normal. And chronic and autoimmune diseases are very common. They are not normal. So today we're going to talk about the topic of anxiety and depression and the autoimmune connection. The reality is that this has to be ruled out. If you're going through anxiety, if you're going through depression or brain fog, an autoimmune response against the brain should be ruled out. So there's three main stages to autoimmunity. Stage 1 is silent autoimmunity, where you have positive antibodies against tissues of the body, but it's silent, it's symptomless. Stage 2 is autoimmune reactivity, where you're having symptoms, you're having positive antibodies, but you're not bad enough to be diagnosed with an autoimmune disease. And then stage 3 is autoimmune disease. The criteria for diagnosis for most autoimmune diseases are abysmal. There has to be 90% destruction of your adrenal glands to be diagnosed with Addison's disease. There has to be 70% neurological destruction to show up on MRIs. So this is inadequate to wait till you decline so bad into a disease process to then be labeled with a disease and then given very little options in the mainstream model then anyways. But getting answers as to why you feel the way you feel is hugely important. So running labs, immunological labs, to find out, hey, what's going on in my body? Why am I going through anxiety and depression? Nobody has these problems from a pharmaceutical deficiency. So let's find out key mechanistic issues to explain what's going on in my body. So one of the labs we run in our functional medicine center is a lab called CYREX, and it's neurological autoimmune reactivity, or that's stage 2, where you're not so bad that you're an autoimmune disease, but maybe you are, but we're just looking at, is the immune system attacking the brain and nervous tissue? So let me flip the camera here. This is a patient of ours that actually lives in the Midwest. She lives in Michigan, and we're here in Pittsburgh. So we do webcam consultations for her, and she's going through debilitating anxiety. And you can see here, this is the green is where she's having normal antibody production. In the yellow and in the red, she's having abnormal immune response against the brain tissue, against her nerves, against part of her brains, against the neurological system at large. So we're dealing with this case here where this is autoimmune reactivity. We're seeing immune reactivity against nervous tissue. And this girl is a teenager, and she's going through debilitating anxiety attacks, debilitating depression. She goes to her doctor, and they tell her, just take this antidepressant, take this anxiety medication, and there's no explanation for why you're going through this. It's just a chemical imbalance. The reality is that her immune system's attacking her brain. So there may be a neurotransmitter imbalance, but it's because the immune system's attacking the nervous system. So this gives insight into, hey, why am I going through these problems? And then we have to dampen the inflammation, dampen the immune response, modulate the immune system, and hopefully put this thing into remission and slow down this response. Once it's fully triggered, there's no cure for autoimmunity, meaning that you always are going to have to be vigilant in modulating your immune system. But there's so much you can do to reverse these problems, to live a healthy, happy, enjoyable life. And it's interestingly enough, is from a clinical standpoint, in other parts of the body it's not true to this always, but in the brain tissue, the higher the antibodies are, the higher the destruction is. In other areas, they're just sort of tags, and then the cytokines, the natural killer cells, come and destroy the tissue. But for brain tissue, the higher your antibodies, the more destruction there is. And this girl is a young girl with a lot of antibody destruction against her nervous tissue, against her brain tissue. So for more information about this, about other autoimmune labs and brain labs, go to drwirlcole.com. You can set up a free health evaluation where we do a webcam or phone evaluation for people around the world to talk about your case, and you also can look up more information about this on the blog as well. Okay guys, I'll talk to you later. Have a great day.